Today I will be presenting sickle cell disease or sickle cell anemia. Sickle cell disease occurs among about 1 out of every 365 African American births. 1 out of 13 African Americans are carriers for sickle cell trait. Some people with the disease can remain without symptoms for years, while others do not survive beyond infancy or early childhood. Sickle cell is genetic, meaning that it can only be inherited and is not contagious. People of all races and ethnicities can inherit sickle cell, but it is more common in people from parts of the world where malaria is common. People with sickle cell have an increased risk of infection, and there is currently no known cure, but bone marrow transplants and stem cell research is being done to change that. Sickle cell is usually diagnosed in infancy through newborn screening programs, but if you or your child develops any of the following problems, you would want to see a doctor right away and seek emergency care. People suspected of having sickle cell will experience unexplained episodes of intense pain. These are periodic episodes called pain crises that can last for any length of time and can range from mild to severe. People suspected of having sickle cell will also experience swelling in the hands or feet, also known as dactylitis. This is due to blocked blood flow in and out of the distal extremities. Someone suspected of having sickle cell anemia will have an increased risk of serious infection, and fever can be the first sign. So frequent infections or fever can be a sign of sickle cell anemia. People with sickle cell anemia might also experience pale skin or jaundice. The pale skin will be due to reduced blood flow from the anemia caused by the sickle cell, and they experience jaundice or a yellow tint to the skin or the whites of eyes. You would also want to seek emergency care right away if you see any symptoms or signs of stroke. If you notice one-sided paralysis or weakness in the face, arms, or legs, confusion, trouble walking or talking, sudden vision changes or unexplained numbness, or severe headache, you need to call 911 or your local emergency number right away. Signs and symptoms of sickle cell anemia usually appear around 5 months of age. They vary from person to person and change over time, but these signs and symptoms can include anemia, which is a common symptom of sickle cell because sickle cells break apart easily and die, leaving you with too few red blood cells. Red blood cells usually live for about 120 days before they need to be replaced, but sickle cells usually die in 10 to 20 days, leaving a shortage of red blood cells causing anemia. Without enough red blood cells, your body can't get enough oxygen, causing fatigue, tiredness, irritability, dizziness, and lightheadedness, fast heart rate, difficulty breathing, pale skin color, jaundice, slow growth, or delayed puberty. Along with anemia, pain crisis is also a common symptom of sickle cell anemia. Pain develops when the sickle cell-shaped red blood cells block blood flow through tiny blood vessels in your chest, abdomen, and joints. Pain can also occur in your bones. This pain varies in intensity and can last for a few hours to a few weeks. Some people have only a few pain crises a year, while others have dozens or more a year. A severe pain crisis requires a hospital stay. Sickle cell anemia patients can also have chronic pain that can result from bone or joint damage, ulcers, and other causes. Along with anemia and pain crisis, there are a wide array of symptoms that are caused due to the blockage of blood flow by these sickle cells. This can cause a number of problems, including stroke, pulmonary hypertension, and other complications. Sickle cells accumulate and block blood flow in blood vessels. It can cause a number of complications. Stroke can be caused because the sickle cells block blood flow to an area of your brain. Signs of stroke can include seizures, weakness, numbness of your arms and legs, sudden speech difficulties, loss of consciousness. If you experience any of these symptoms, you need to seek medical treatment immediately because a stroke can be fatal. Along with that, acute chest syndrome is a lung infection or sickle cells blocking blood vessels in your lungs that can cause a life-threatening complication, resulting in chest pain, fever, and difficulty breathing that might require emergency medical treatment. People with sickle cell can also develop high blood pressure and pulmonary hypertension in their lungs. This complication usually affects adults, causing shortness of breath and fatigue, and are common symptoms of this condition which can be fatal. Sickle cells also block blood flow to organs, depriving the affected organ of blood and oxygen. In sickle cell anemia, blood is also chronically low in oxygen, and this lack of oxygen-rich blood can damage nerves and organs, including your liver, kidneys, and spleen, which can be fatal. Sickle cells can also block tiny blood vessels that supply your eyes. Over time, this damage to your eye can lead to blindness. Sickle cell anemia can also open sores in your legs, causing leg ulcers. The breakdown of red blood cells produces a substance called bilirubin, and a high level of bilirubin in your body can lead to gallstones. Priapism is a condition with men with sickle cell anemia. They can have painful, long-lasting erections, and it can block the blood vessels in the penis, which can lead to impotence over time. Sickle cell anemia can increase the risk of high blood pressure and blood clots during pregnancy. It can increase the risk of miscarriage, premature birth, and having low birth weight babies. Sickle cell disease is a lifelong condition caused by a problem in the hemoglobin beta gene found on chromosome 11. The defect forms abnormal hemoglobin. A blood test can check for a defective form of hemoglobin found in people with sickle cell disease. This test is available for newborns, older children, and adults, and in the U.S. it is a law that this test is a routine part of screening for newborn babies. If the sickle cell gene is detected, additional testing will be done to determine if the patient has sickle cell disease or is a carrier for the trait. People with sickle cell disease start to have signs of the disease during the first year of life, usually around 5 months of age. The reasons that infants don't show symptoms at birth is because baby or fetal hemoglobin protects the red blood cells from sickling. When the infant is around 4 to 5 months of age, the baby or fetal hemoglobin is replaced by the sickle hemoglobin and the cells begin to sickle. So, what is sickle cell? As mentioned before, sickle cell is an inherited blood disorder in which normal red blood cells are sickle or crescent shaped and cannot adequately carry enough oxygen through the bloodstream. Normally, the flexible round red blood cells move easily through blood vessels. In sickle cell, red blood cells are shaped like sickles or crescent moons. They are C-shaped, like the form tool called a sickle. Because of the lack of hemoglobin, these cells are rigid and sticky and can get stuck in small blood vessels, which can slow or block blood flow and oxygen to parts of the body. These cells, because of the lack of oxygen and normal hemoglobin, they also die off early and cause anemia. There is currently no cure for most people with sickle cell anemia, but treatments can relieve pain and help prevent complications associated with the disease. The National Institutes of Health advises that optimal care for patients with sickle cell includes prevention care is best achieved through treatments in clinics and specialized care. All patients should have a principal healthcare provider and should either be a hematologist or frequent consultation with one. Preventative treatments include drinking plenty of water, trying not to get too hot or too cold, and avoiding places or situations that can cause high exposure to high altitudes. Try to avoid places or situations with exposure to low oxygen level and practice good hygienic habits to avoid infection. Common treatment of sickle cell are blood transfusions frequently, and they're used to treat the severe anemia. Vaccines also can help protect against harmful infections. Stem cell transplant or bone marrow transplant is a procedure that involves replacing the bone marrow affected by sickle cell anemia with healthy bone marrow from a donor. This process is usually long-lasting and requires a hospital stay and is only done in children with severe sickle cell anemia complications. Medicine provided for sickle cell anemia includes hydroxyurea, which is common and taken daily, L-glutamine oral powder, crizanlizumab, and pain relievers such as narcotics, as well as another type of medicine called oxybrita. Many athletes can have the sickle cell trait or have sickle cell disease. If an athlete has sickle cell disease, they should not participate in any high-level athletic participation. So having sickle cell trait is not a barrier to exercise or participation in sport, but athletes with the trait are potentially more vulnerable to gross hematuria, splenic infarction, exertional heat stroke, rhabdomyolysis, and even potentially sudden death when participating in strenuous exercise, often under intense environmental conditions. The NCAA recommends that athletes with sickle cell trait be knowledgeable about their condition and take the following precautions, such as setting their own pace, gradually acclimating to heat, humidity, and altitude, using adequate rest and recovery between intense conditioning sets, limiting all-out exertion of any kind to less than 2 to 3 minutes, and be excused from performance tests that require extreme exertion for longer than 2 to 3 minutes. They must stop activity immediately if any signs or symptoms occur. They need to stay well hydrated at all times, especially hot and humid conditions. They need to manage asthma appropriately, suspend exercise if feeling ill or while experiencing a fever especially. They need to have access to supplemental oxygen as needed, and they need to seek proper medical attention when experiencing unusual distress. They should not participate if they have an acute illness, especially one involving fever. It is our job as athletic trainers to be well aware of our athletes' sickle cell trait, if they possess it or not. And we need to be completely aware of what they are doing in all their exercises and what conditions they're doing them in. While there is an estimated 1 million to 3 million people in the U.S. who have the sickle cell trait, it is becoming increasingly common in the U.S. to be a carrier. If you have 2 people that carry the sickle cell trait, the likelihood of their children having that same trait is 75%, and it's actually 25% of their children will actually have sickle cell disease. African American couples should get tested for sickle cell and meet with the genetic counselor if the trait is present before having children, because it is likely that their children or one of their children will have sickle cell disease. Living with sickle cell involves a life of ongoing health care and awareness and requires a certain lifestyle to maintain and prevent complications. Sickle cell requires that the patient find a way to cope with pain, but many individuals often suffer from depression. Episodes that are treated with narcotics also increase the risk of substance abuse and addiction. Many Americans are unaware if they even carry the genetic trait for sickle cell disease, which is why awareness and testing is especially important.